In this morning's health check, it may seem like Mother Nature did many people a favor by giving us a mild winter, but that has caused a nightmare allergy season. It is both earlier and more severe than usual. That means allergy sufferers are miserable, and the sneezing, nasal congestion, and other symptoms are even affecting people who normally sail right through allergy season relatively unaffected. So what can you do to get some relief? Dr. Dat Tran is a pediatric allergist at Children's Memorial Hermann Hospital and assistant professor in pediatrics at UT Health, and he has some tips for us. Thank you so much for joining us. I will say that I'm probably number one who came in this morning sneezing and sniffling. So first of all, is allergy season earlier this year?
Yes, being an allergy sufferer myself, I think one of the explanation, which is also proven if you go to the data collected by the Houston Health and Human Services, where they track pollination throughout the year. The record-breaking drought in 2011 really caused a dramatic reduction in pollination because, you know, there's no vegetation, no plant growth, then there's no pollination. So then now with no longer a drought period, now you have an increased pollination. So those people who have a dramatic relief last year is now starting to feel this symptoms as more pollination. And you can see that over December, January, and February, there's been increase in pollination in certain time during that month for both tree and also for mold. So people are feeling those symptoms.
So tell me a little bit about what can you do to prevent some of the, I mean, sometimes it is just an attack of the allergies. So what can you do to prevent some of this?
Right. So allergy, but most of the time the symptoms you're feeling is because your body releases histamine, which is a component, normal component in your body. So that's why when you take antihistamine, which are commonly known as Benadryl, Zyrtec, Allegra, Claritin, those are very effective blocker of histamine. Not everyone have the same effect, so be very careful about the side effect, which is usually being sleepy, and that can affect your work, your driving. But now that they're readily available over the counter, these non-sedating antihistamine, once you try that, and then, you know, if you're not getting that effect, go see your doctor, because a lot of these symptoms are not just allergy, because you have nerves in your nose and your lungs, and those can trigger the same kind of symptoms with change in barometric pressure and with the temperature. So some of these symptoms that people are feeling right now may be due to just the climate changes.
So basically, don't diagnose yourself and say it's allergies. You should also see the doctor. And also, I think you mentioned something similar to this, but, you know, there are a lot of over-the-counter meds for allergies, and when you're having an attack, like me sometimes, you want to just go and grab whatever it is. What should you be aware of when you go looking for that type of med over the counter?
Now that the non-sedating antihistamines, such as Claritin, Allegra, Loratadine, now that they are available over the counter, I would suggest going with that first, because prior to that, what's available over the counter are, like, example, Benadryl, which are very effective with the symptom, but makes you very groggy.
Yes, it
which
does.
is fine if you're taking it at night, but during the day it will affect your driving, your work, and that can be very dangerous.
Right, and we, of course, don't want that. So, and our last question, is this worse than usual? We talked about it being a little earlier, but what about the allergies? Are they worse now, or?
I would say they appear to be worse because the year before were better. So then people start to feel better, and then now that they have that, and then it's just feel worse. But I think overall, it probably this varies from year to year, but I wouldn't say it's worse overall if you look over the last decade, but I think it's worse compared to the year before.
All right. Well, thank you so much, Doc. And great advice coming from someone who suffers from allergies yourself.
Thank you.
Thank you so much.